Hello everyone, I am Deepak Sharma, Clinical Regional Manager, DCDC Health Services Private Limited. Today we will talk about vascular access handling, and after this topic you will be aware about the correct ways of vascular access handling. Vascular access definition. A vascular access or hemodialysis access is a way to reach blood for hemodialysis. The access allows blood to travel through soft tubes to the dialysis machine, where it is cleaned as it passes through a special filter called a dialyzer. An access is placed by a minor surgery. Types of vascular accesses. First, temporary vascular access. Second, permanent vascular access. Temporary vascular accesses, also called acute vascular access. Acute vascular access device may include dual-lumen temporary hemodialysis catheters. Permanent vascular access. Types of permanent vascular accesses. First, arteriovenous fistula. Second, arteriovenous graft. Third, cuffed tunneled catheters. Example, pump catheter. Temporary vascular access handling. Internal jugular catheter HD initiation. First, wear PPE first and ensure you have performed hand hygiene. Second, bring all the necessary consumables for catheter handling. Third, after taking patient's vital, remove old dressing with examination gloves. Fourth, remove examination gloves and perform hand hygiene, then wear surgical gloves and clean the exit site with chlorhexidine solution. Fifth, if chlorhexidine not available, then use betadine solution and leave for minimum 2 minutes. Temporary vascular access handling. Internal jugular. Now perform temporary dressing to initiate dialysis. Don't spray any kind of liquid solution on catheter dressing directly to remove the dressing. Don't touch catheters with bare hands. Temporary vascular access handling. Internal jugular catheter troubleshooting. Firstly, try to aspirate with 5 ml syringe. Second, if the flow is not achieved, then use 10 ml syringe. Third, if still the flow is not achieved, then use 20 ml syringe. Fourth, now you may get the blood flow from the catheter. Temporary vascular access troubleshooting. Some other points. Don't cut the stitches. Don't pull out the catheter. Don't bend the catheter. Don't push normal saline forcefully in the lumens of catheter. Temporary vascular access handling. Internal jugular catheter HD termination. First, at the end of the dialysis, perform hand hygiene. Second, bring all the required consumables first. Third, perform hand hygiene and wear sterile gloves, then perform dressing. Now, don'ts. Don't perform dressing with dirty gloves or dirty hands. Don't pack the catheter without caps. Don't haplock with inadequate anticoagulant. Don't pack catheters in such a way that patients feel uncomfortable. Permanent vascular access handling. AV fistula handling during HD initiation. Firstly, wear PPE and ensure you have performed hand hygiene. Bring all the necessary consumables for AV fistula cannulation. After taking vitals, perform hand hygiene and check for fistula patency like thrill and bruit. If the fistula is good, then perform hand hygiene and use consumables by maintaining their sterility. Clean the herb means cannulation area with chlorhexidine or alcohol-based hand rub. Anticlockwise. Place fistula needles and secure with tapes with chevron technique. Permanent vascular access AV fistula handling. If cannulation is not successful, then ask any other technician to cannulate. Note: don't prick more than 2 times. Ensure that needles are placed correctly. After that, start dialysis. Keep blood pump speed at 120 ml per minute initially. Don't prick again and again. Don't use fistula if infection is visible. AV fistula handling post-dialysis. Carefully remove needles after dialysis. Use sterile gauge and apply gentle pressure. Hold the gauge until the bleeding is stopped. Now don't tie fistula belts or bandages with excessive pressure. Don't give any subcutaneous or intramuscular injections in the fistula arm. Educate patient about fistula care at home. Here is a question for you. Mr. Shankar came to the dialysis unit with new fistula and you are the responsible therapist to cannulate his fistula for the first time. Explain what precautions you will take before cannulation, which checks you need to perform for successful cannulation. Please post your answers in comment box. We'll pick the correct answer and will notify you. And for any query or questions, contact clinical team at DCDC Health Services Private Limited. Thank you.